I'm looking at how medical imaging has been delisted from public coverage in Quebec when it is provided in a private setting. This happened in the 1980s, so we have to go back to that period where it was a massive economic crisis. The federal government had cut its spending on healthcare, its transfers to the provinces, and so the provinces were left with having to pay with what was just increasing costs. And so what Quebec did in order to limit or to contain the costs of healthcare is to delist some of these medical imaging services. At the time, this was just mammography and ultrasonography and thermography. But through the years, it then was also extended to MRIs and CAT scans. And so right now, Quebec is one of the provinces with the most private facilities, actually, in Canada. It has 31 of the 58 private facilities providing MRI and CAT scans in Canada. So that's more than half just for the province of Quebec. The concern with that is that it has the potential to lead to vertical inequity, whereby those individuals who need care the most may not be getting it the fastest, because those individuals with private health insurance can jump the queue relative to the public system. You could argue that that leads to more patient choice, so that could be an advantage of the system. But when we have limited human resources, and these human resources are either providing services in both the public and the private, as in the case of certain physicians, or moving to the private sector, as in the cases of some nurses and technicians, for instance. When we have those limited human resources, then that can lead to a scarcity of services in the public sector. If you compound that perhaps with less investment in infrastructure in the public sector, then you have a problem of access. And this is a problem, obviously, for physicians and also for patients for accessing care.